The state of Azad Kashmir borders the Indian-occupied Kashmir to the east, Khyber Pakhtunkhwa to the west, Gilgit-Baltistan to the north, and the Punjab province of Pakistan to the south. On its eastern side, Azad Kashmir is separated from the Indian Union territory of Jammu and Kashmir by the line of control. The state covers an area of 13,297 square kilometers that comprises of 3 divisions and 10 districts, with an estimated population of about 4.3 million. Lush green mountains with the valleys of mystified splendor, flowing rivers, and winding streams are characteristics of AJ&K geography that is bequeathed with numerous natural resources. The population comprises of 88% rural, ratio 12% of urban. The life expectancy at birth is 68 years lower than the global average of 74 years. The health infrastructure includes 26 hospitals, 802 other health facilities units, 2,790 hospital beds, and 14 teaching and training institutions including medical colleges and others. With access to public health facility of 81% of the population per bed is 1,451. Per doctor is 4,050. Per dental surgeon is 51,265. Nurses per hospital bed ratio is 1:4. Despite of great challenges, the government is determined to reach the World Health Organization recommended golden finishing line. The key health indicators include an infant mortality rate of 47 per 1,000 live births. The maternal mortality rate is 104 per 100,000 live births, with a fertility rate of approximately 4 children. Through the effective vertical programs, the lady health worker coverage of 67% is achieved, while EPI coverage is at 88%. The major disease burden is that of non-communicable diseases as compared to the communicable, maternal, neonatal, and nutritional factors. Universal health coverage stems from Sustainable Development Goal number 3, good health and well-being. Our government realizes the international commitment towards UNWHO to achieve the target of 65% by 2030. Contributing our share in conferring the commitments, AJ&K needs a robust mechanism of system reforms. We look forward to our collaborating partners with high regards to World Health Organization in further strengthening the partnership wherever in the areas of persuasive governance and leadership, better healthcare services, and ethically motivated human resource involved in strengthened health workforce. Wider health financing ensuring maximum financial risk protection, authentic health information, quality medical products and health technology, ensuring all cross-cutting issues such as equity, gender, nutritional disparity, safe water and adequate sanitation, education, urbanization, disasters and climate change. All these areas are looked into prudently. Hence, ensuring the access to quality essential healthcare services and access to safe, effective, quality, and affordable health services. Our state is a disaster-prone area. From decades, it has encountered major catastrophes such as earthquakes, floods, avalanches, COVID-19 pandemic, dengue fever, and an ongoing border security concern for extensive stretch line of control area that borders with the Indian-occupied Kashmir. These all calamities have disrupted the health systems of even the most developed economies of the world in an unprecedented manner, and so of ours. The state acknowledges the substantial methodological and enduring support by World Health Organization to Azad state of Jammu and Kashmir. Under dynamic leadership of His Excellency Dr. Palitha Mahipala for his special consideration for AJ&K instantly and commendably accomplishing and supporting public health emergencies in the state, along with the smooth organization of regular programs like expanded program on immunization, polio eradication initiatives, maternal, neonatal, and child health, and others. Establishing MUPRO training school, provision of human resource, technical support during regular programs and aids during the several disasters, capacity building, training of doctors, nurses, and paramedical staffs, multiple supplies including physical, medical assets, equipments, and others. We are thankful to WHO leadership for being inclusive in its strategic approach in strengthening the health system in the most vulnerable populated area of line of control. The out-of-pocket spending on health constitutes a large percentage of total health expenditure. It is imperative that the maximum number of the poorest people will be covered through social protection for health. Taking a very positive step, the current government by introducing Sehat Sahulat program with special attention to those living below the poverty line of $2 per day in AJK. Our government, with the great support of the Ministry and the Department of Health, has covered 76% of the beneficiaries and targeted to reach 100% of 1.2 million families. The vision of the Prime Minister of Azad Kashmir, Honorable Mr. Abdul Qayyum Niazi, is that of a vision followed by the Prime Minister of Pakistan, Honorable Mr. Imran Khan. A welfare state, which was introduced by Prophet Muhammad, peace be upon him, that aimed at looking after the poor and providing basic facilities to all. Following the welfare model of development governments who are bound to provide all basic facilities to their citizens, the government aims at triumphing many milestones. Prime Minister's vision is to achieve economic growth by promoting high moral values in the economy. Our government has always been humbled by the assistance the international agencies have been extending, in particular the decades-long contribution of United Nations World Health Organization and personal interest of His Excellency Dr. Palitha Mahipala, who has proved his leadership over these years for stabilizing the impaired health system. We look forward to you for collaborating with us in further sustainability of infrastructure, capacity building and implementation interventions to help achieving the 2030 Agenda for Sustainable Development.